BeakerBeat.
It's Monday, October 10th, 2011, and this week's Beaker Beat is the river of venture capital money flowing into the life sciences industry drying up. A new survey reveals a disturbing and costly trend. Plus, what are the biggest hurdles facing the medical device industry? We ask the CEOs themselves what they think. And life is about beginnings and endings. We say hello to a future Beaker star and goodbye to a legend. All that and more in this week's edition of Beaker Beat, brought to you by Allergan. To learn more about Allergan, visit their company webpage on Beaker.com. Hello everyone, welcome to this week's edition of Beaker Beat. I'm Mike Justice, thanks for tuning in. Well, it's a big day here in North America. In the States, it's Columbus Day, where we honor the man who went looking for India, but stumbled onto our shores instead. And it's Thanksgiving Day in Canada, where they do what we do, only we do it in about 6 weeks, which is they watch a lot of football, they drink booze, and they eat turkey until they pass out in a food coma. Now, I've decided that having one Thanksgiving Day is not enough, so I'm going to join the Canadians in some turkey gobbling goodness. And this hockey jersey just felt like the proper attire. Anyway, here's this week's top story. Bloomberg reports that fewer investors are putting money into new drug and device makers because of regulatory concerns. A survey conducted by the National Venture Capital Association found that about 40% of the 150 venture capital firms that responded decreased their life science investment in the last 3 years. And the same proportion say they'll continue to hold back over the next few years. If that proves to be the case, the shortfall could starve the industry of $500 million. So what's the problem? Well, in a nutshell, Terry McGuire of Polaris Venture Partners says, quote, "The process has gotten to be so long and the capital required so deep that it's becoming more and more difficult to generate venture-type returns and therefore make it worth your while to do it." The NVCA clearly had an agenda in mind with its survey, and the numbers put the blame on the FDA for the downward trend. Now, this is nothing new for the FDA, which has been feeling the heat recently from the country's drug and device developers. Because of the increasingly expensive hurdles faced by developers in the U.S., venture groups claim to be more interested in investing in overseas companies. 1/3 of the VCs surveyed say they will increase their investments in Europe, with 44% favoring Asia and only 13% looking at North America. Obviously, the VCs want big changes from the FDA. FDA Commissioner Margaret Hamburg has a plan, saying that innovative new drugs targeted at serious unmet medical needs will be provided, quote, an expedited drug development path. A new deputy FDA commissioner will oversee the regulatory process for drugs, biologics, and cell-based treatments. Personalized meds will be given a top priority, and top biotech entrepreneurs will be asked for insights on how the agency can do better. Sounds good, but we'll wait and see if this actually comes to fruition. Adding insult to injury, another Bloomberg story says biotech stocks are now falling even after firms receive approval for their drugs, which goes against the norm. Apparently, investors fear the risks of commercial disappointment, such as logistical issues with the launch, reimbursement hurdles at the start, and physician comfort in the first few months. So tell us what you think about this story or any story that you see in today's show. It's very simple. Click on the orange button below me, a box will pop up, type in your comments, send it to me. I promise I'll read and respond to every one of them. Now, I don't know how the Canadians do it, but in the States, we have big traditions here for Thanksgiving, and that includes canned beans and stovetop in a box, just like the Pilgrims did it. And when you're done watching Beaker Beat, check out Beaker's blog and see how yet another company famous for electronics is getting into the life sciences biz, plus another ominous sign in sequencing. Those stories and more on Beaker's blog. As you probably know, Beaker recently attended and participated in the world's leading medical technology and diagnostics conference, AdvaMed 2011, the MedTech Conference. Compared with 2010, attendance at AdvaMed 2011 was up nearly 12%, and CEO-level participation rose 5%. We had the unique opportunity to interview several of those CEOs, and here's what they had to say about the challenges facing the industry.
I think our customers and payers are under a lot of pressure to reduce their costs, and they need to be able to provide high-quality health care for less. We need to think about how our technology can help them accomplish that, and that's a little different way of thinking. We used to be able to introduce innovations, and they would just be adopted because they were good for patients. Today, there's also this added dimension of being able to help with the economic realities that are facing us tomorrow.
You know, I think there's a lot of uncertainty. I mean, I think at this stage, when there's uncertainty, people get concerned, which impacts our business because then hospitals don't make the investments that they need. Look, we're in, you know, Mako Surgical is a robotic surgery company in orthopedics, and we have a piece of capital expenditure that we need hospitals to invest in. And when there's uncertainty at the hospital level, at the provider level, in terms of making sure that they have enough money to provide the type of services that they need, you know, it impacts our business. So uncertainty, I think, is not our friend, and we have to get clarity.
As an emerging growth company, I think reimbursement is the key for us. When I've had the opportunity to discussed this with my colleagues on the AVIMed board who are from much larger companies than Regenesis. They seem to be focused in the area of meeting compliance demands.
Well, in the States, I think everywhere globally at the moment, in the developed world, it's hospitals or doctors or clinics, whatever it is, not spending money. That is the biggest barrier to growth in the industry, fairly obviously, because we get money for selling our products. But when the whole thing's set up against you to not spend, it's very difficult to make progress with that. So that's why I think a lot of it's down to a bigger picture. We need to take what we've got, the value propositions, and go out there and really hammer them home. Because the real costs in healthcare come around, the people. It's no different to a factory. If you can do the same things better with fewer people, then that's efficiency. Very rarely do our devices make the hospital less efficient. They almost always make it more efficient, and that's what we have to start to really push home as an industry with a united voice. And some of these things we need to join together with the diagnostics, maybe even with the pharmaceuticals, and have a very strong agenda on that. These are agents of change, and it's positive change rather than things which are putting us backwards.
Check back again next week for more insight from our CEO interviews at AVIMed 2011, the MedTech Conference. Look at that big, beautiful, juicy, delicious Cornish hen. I can't really afford a turkey. Do you know how much turkeys cost here in the States in October? It's ridiculous. It's like they're made out of gold. So this thing's going to have to do. I thought about doing Canadian bacon, but that was kind of obvious. Merck extended its Januvia franchise with the FDA approval of Juvasync, a combo pill made up of the company's diabetes drug and its now off-patent cholesterol pill Zocor. The new drug allows Merck to target patients with type 2 diabetes and high cholesterol, conditions that often arise in tandem. Merck estimates there are 6 to 8 million type 2 diabetes patients who could benefit from their product. A Northwestern University report found that more than 75% of U.S. medical device firms turn to overseas markets first before filing for a 510K clearance, driven in part by unpredictability, high costs, and long review times associated with the FDA process. The study, commissioned by the Institute for Health Technology Studies, was a counter-response to an Institute of Medicine report that called for the elimination of the 510K process. AstraZeneca will cut 400 jobs from its commercial business in the U.S., with most of them coming from its Wilmington, Delaware headquarters. These layoffs follow the nearly 18,000 cuts by AZ since 2007. Abbott Labs is eliminating 160 jobs from its diagnostic division. 150 of those cuts are manufacturing positions from its Santa Clara, California location. Meanwhile, Medtronic said it will invest $50 million and hire about 200 more workers as part of its 3-year plan to expand its operations in Puerto Rico. An FDA report details how the agency reviews medical devices, including its creation of standard tests for performance and durability and its use of computer modeling. The agency released a report titled Regulatory Science and FDA Center for Devices and Radiological Health, a Vital Framework for Protecting and Promoting Public Health. Whew, nice short title. Anyway, the report is to offer investigators, clinicians, industry, and patient groups an insight into activities the agency carries out in support of new devices and the protection of public health. The growing demand in emerging markets has Sanofi planning to open a vaccine manufacturing plant in India, slated to be Asia's largest, as early as March. The announcement comes 2 years after the French developer purchased India's Shantha Biotech for $784 million. Sanofi has spent another $300 million since the buyout to expand its vaccine capabilities through Shantha. Illumina must feel like those protesters on Wall Street. But while those protesters are getting beaten by the cops, Illumina is taking a beating from Wall Street investors. The San Diego-based provider of scientific tools such as DNA sequencers announced lower than expected earnings by over $40 million, and investors reacted by sending the company's stock down about 32%. Illumina's third quarter revenue of $235 million comes amid concern about the future of research funding in the U.S. and Europe. Atrium Medical, a maker of vascular grafts and related devices, will be acquired by Sweden-based Getinge Group for $680 million. The deal could be completed as early as November 1st. So, as I prepare to eat my Canadian Thanksgiving, although a smaller version of it, I feel like I should sing their national anthem or something. Oh, Canada! That's all I know. Finally this week, we close our show with an ending and a beginning. First, you've all heard about the passing of Apple founder Steve Jobs, whose impact on technology and our daily lives rivals that of Henry Ford and Thomas Edison. Specifically, his impact on the life sciences industry has been both tangible and intangible. His iPhones, and even more so the iPad, have changed the way we operate on business, personal, and global scales. With apps to monitor ailments and conditions, to a sales and demonstration tool and more, these unique devices are being adopted by thousands of individuals and companies. The intangible impact he had is time, as in less of it. It takes less time, thanks to these devices, to perform the daily work in the life sciences industry. And his passing is a reminder that while we're all very busy working, we may have less time in this world than we think. Jobs is considered by many to be our generation's greatest innovator. Perhaps one day the innovators working in the life sciences industry will find a cure for the cancer that took his life. Drugs like Dendrion's Provenge shows that promise. And now a beginning. Last week, the life sciences industry added a new thought leader as Beaker welcomes a new addition to its family. Daughter of the chief Beaker, Little Miss Hampton Pace is soon to be roaming the halls at Beaker headquarters, making big decisions. Hopefully, she'll give us a raise. Wink, wink. Well, that's it for this week's edition of BeakerBeat. I'm Mike Justice. Thanks for watching. We'll see you next week. Canadian Thanksgiving is delicious. It's a little bit smaller. And a lot less angry. Could use a moose head. Sit, Beaker. Sit. Good dog. Hey, who ate all the pie? Jeremy.